So I've been so welcome everyone to the sort of second workshop. They asked me to come along and just tell you a little bit about the positive pathways for children and young people, a model that we've developed in Thurrock, really centred around a person-centred planning model. I'm Helen Farmer, I'm Assistant Director for Integrated Commissioning for Children and Young People for Thurrock CCG. So welcome this afternoon. I've got a few slides to go through to give some background and some description of the service, and fingers crossed a film to show you. And then if it's okay with everyone, then we'll have time for sort of some questions and sort of afterwards, and sort of sharing of anything you're doing locally, but also any sort of questions on what we've done in Thurrock and how we went about it from your perspective, anything we can help with further. So it's a programme that's been in place now for just about I think it's coming up to 18 months now. So it's a fairly new programme. We introduced it as very much a test and learn approach and a pilot approach, starting quite small, and then it's built and built over time. And we've just recently got secured some additional funding to extend the model to reach a wider cohort of children, and I'll tell you a little bit more about that as we go forwards. So I wanted first of all to give you share this diagram, which some of you may be familiar with, around the personalised care model for all ages, just the way the model works and how it looks at things. And it kind of uses that kind of traditional sort of public health triangle model with whole population at the bottom, where we've got a universal offer delivered by a range of services, and really supporting people to stay well and building community resilience and enabling people to make informed decisions and choices when their health does change, even if it's a short-term change. And then above that, we've got 30% of the population where people might live with a long-term physical and mental health condition, and they might be in receipt of more targeted services where there can be sort of more proactive finding around cases and an approach around personal care and support planning through maybe your GP and through other sort of targeted services. And that looks at supporting people to build their knowledge and skills and confidence, and to live well with their health conditions and conditions that they're living with. And then you get to the sort of peak of it, of the 5%, which are those with very complex needs and are in receipt of more specialist support. And perhaps this group is where our traditionally commissioned services might not meet the needs very well or very effectively, and you really need to think of a more flexible approach and a more nuanced approach around personal care and designing services with young people and people themselves, and developing a more nuanced approach, and with the offer of perhaps personal health budgets to support delivery of those plans. I've just shared this one as well, which is a national resource available on NHSE websites, and it was co-produced with public and members and those with long-term conditions. And it just is a very sort of cartoon illustration of what it means and what we mean. It's very sort of cultural shift, a shift in relationship between health and care professionals and the people in which we serve and work with and alongside. And you can see that this describes to me a very, a very good way of a description when you're describing personalised care, which is sort of being less seen as a patient with symptoms and more as a whole person. The language changes, what's the matter with you, to what matters to you, becoming a sort of a less of a sort of a specialist professional and sort of patient relationship to that reflects a more equal partnership in the conversations and decisions about health. It goes from sort of not having any information and not being informed to having very lots of information and support available to support you making informed choices and decisions about your health. Recognizing that one size fits all doesn't necessarily work in some in some circumstances, and that having choice and control is really important. It moves from sort of feeling powerless to feeling empowered and shared powered, and then sort of making decisions around in partnership with the professional, not as a passenger in the driving seat, but as a side by side, and sharing knowledge and expertise and responsibility and expertise in your own care. And again, sort of that, we've heard this frequently, sort of this, the need to tell your story over and over again shifts to telling your story only once. So the positive pathways, which is the model in Thurrock, that's under development. I'd say we're still learning every day around the model and modifying it and evolving it as we go forwards. But basically, Thurrock CCG, we're talking and in liaison with our sort of mental health service provided by NELF, which in Essex is called UME, so Emotional Wellbeing and Mental Health Service. And we were speaking a lot to them around the challenges that they were facing, that the waiting times, that actually, you know, the barriers that they were facing, and how we were very mindful and thoughtful about how we could help them face those challenges. And we got together a group of people to start with, the Thurrock Mind and other third sector in the area, and started to talk about sort of how we could work in partnership to deliver a more personalised care approach for young people when they're coming up for discharge to the from the mental health service. And we found that that clinicians were telling us that they were not reluctant, but even after the clinical need had passed, if you like, they were nervous and reluctant and worried about discharging young people because they didn't feel there was much support out there to support to help them keep well, and there was a fear of them being referred to the service and the deterioration in their mental health and emotional well-being once they were discharged, but also mindful that they had long waiting lists and that there were many children that required the service. So we looked at, although we don't call it social prescribing model locally, but it is akin to, and you might recognise it as a very much an approach that's based on the social prescribing model, and a terminology that's used commonly at the moment within primary care and the personalisation agenda. But it doesn't really fit, we've had lots of conversations, doesn't really fit with the children and young people's model per se. So we commissioned Mind to employ a youth facilitator who is now based within the children's mental health service locally in the core team. And by that I mean that they very much are part of the service. They have a desk there, they see children there, they are involved in their MDT conversations and case review conversations, and very much sort of an integrated seamless service with the children's mental health service that we have. The clinician will first of all identify a young person who would benefit from additional support as they prepare to be discharged from the service. So this is someone who they feel that might have additional risk factors and at risk of there is and need support, sort of really carrying on that journey of building resilience once they've left the service. Following introduction and consent that's gained from the clinician, the service will the clinician will meet with the facilitator and the young person and their family, and they'll develop a personalised care and support plan together. This is very much a co-produced plan, and following sort of dialogue around what they see their needs to be and what their ambitions are and what they'd like to achieve in the future, and how in fact they're going to sort of think about keeping themselves well and building on that the work that the Children's Mental Health Service has begun but needs to continue into the future. So it's very much focuses on identified health needs and outcomes, and looking at those protective factors that we know about that are so important for emotional health and mental health well-being. So very much it is a social prescribing model where the facilitator matches and supports the young person to access a variety of community assets and services that are out in Thurrock and nationally in some circumstances, and supports that young person to access them. So so it's very much not, we've found that it's not a signposting exercise. It needs to be much more hands-on than that. The young person needs that physical support to walk alongside them, to access those services, to make the introductions, and then once that's done, for the young person and the service involved to build on that relationship and get that independence and enabling empowerment going on. And that seems to work really well. I'd very much emphasize it's not just a signposting exercise here. And we've also given the ability for that person, the facilitator, to ask for a personal health budget to support elements of that plan, of the personalised care and support plan, where there isn't the resource available currently in the community or through sort of more formal agencies. So they have that flexibility to source support once it's been recognised through a personal health budget. So it's been going a little while, and we've done some reflection on the learning as a team and as a system, and we have found that by bringing sort of the third sector and our children's mental health service together as an NHS provision, that system integration and relationships with partners across the whole of that sort of emotional well-being has really flourished and has benefited from working together, being enabled and facilitated to work together very effectively, and that's grown to develop other programs and projects and closer working arrangements that we weren't anticipating when we first started the program. Very much learnt that it's a whole family support approach, and not just focused on the young person, but actually recognising that young person is within the system themselves, and the well-being and the mental health of their carers, their parents around them is equally important, and is an enabler to ensure that the young person stays well and builds on their strengths. There's been a great sharing of skills, knowledge and information about different services through the dialogue, much better understanding of what each can offer, what each can bring, and therefore the flow of referrals and conversation and picking up the phone, just knowing people has really gone from strength to strength. And with that, I think a much more creative thinking about what's the possible. Not just okay, well, we don't do that, so therefore you can't have it, but actually, or perhaps we can do it this way, or perhaps we can do it in another way. And the professional, family and young person's confidence when planning and following discharge. So it's really given that concern and anxiety that a lot of families and young people have when they're about to be discharged from the service. Well, what happens if, what happens next? There's much more confidence and forward thinking, having that little bit of additional support to carry on post-discharge has been of benefit. With that comes early identification in any deterioration in needs and changes for the young person, with quick intervention and contact points for if that happens, and preventative measures can be implemented quite quickly, or referral back to the service can be enabled if that's what's required. Very much the model is based on enabling and empowering and a strength-based approach, and focusing very much on the local community assets, what's normally out there in the community for young people, but some young people need some support and help navigating those systems, as do families and indeed professionals. Reducing stigma has been a big part of it, open conversations and dialogue about emotional health and mental health and how we keep well. And the service has had established very effective communication through digital applications with young people, and this really came into its own when the coronavirus pandemic hit, and they were able to make contact with young people who were maybe more at risk through this time, to make sure they're okay, and just reaching out through a text or a message system has been proved very welcome by families and children themselves. So here's some examples of what we've done, some of the cases. So we've had a young person with moderate learning difficulties and autism who identified their own outcomes with a peer support, and developed, and with peer support, we commissioned through personal health budget, developed social skills, and now participating in regular sort of physical and voluntary activities, keeping them well. We had another young person with high functioning autism that accessed support and assist with employment and the development of their CV, to apply for a Saturday job, etc. A young person with autism accessed social groups and returned to college with the support of the peer mentoring programme. And that personal health budgets in one case was joined together for a group of children, young people, to deliver a range of taster sessions of activities and hobbies that were designed by the young people themselves and requested. And this was over a pizza event and supper, and coming together as a group. And they did things like they went to have a session on, they got a cartoon drawer in to come in and teach them about drawing and skill sets, and they've done another thing around sports activities, just different range of taster sessions to see if there's anything there that they were interested in and could take forward to the sort of next stages. We paid through a personal health budget for a young person to access some music sessions, and that gave him the confidence to go on and attend college on a regular basis, and has kept up his music sessions in between time as well. And we've also had young people that have gone on to become proactive ambassadors for Mind, so training as ambassadors and then supporting other young people locally as well. So this is where I hope the video will work. I don't think it's, I can see. It's circling, isn't it? But it's not. Something about when I share it, I think, is not going to come on. Oh, no, here we go. Okay. Hopefully, just shout if you can't hear it, Dan, if you could let me know if it's going okay.
Okay, we'll do.
Knowing that I was coming to the end of my CAMS journey, it was quite daunting at first because I didn't think there'd be any other help there.
Thurrock CAMS services were experiencing a high demand and long waiting times for their services, and we were keen as commissioners to look at ways to help them face that challenge. One of the things we found was that clinicians felt that they were holding on to young people into the service and not discharging them.
My worry as a clinician was, where are young people going to go? You know, they're working with us, you build a relationship, you build a rapport, you put your heart and soul into the job, to be fair. And knowing, however, that there's more need out there, there's more young people that need our services. So you're kind of balancing all of the time, you know, when do you discharge, when's the right time to discharge?
So we wanted to find a way of really supporting young people as they transition from the service and move out into the community. It was very important that we developed a person-centred approach and wanted to offer personal health budgets as part of that offer. We developed a business case that was presented to the Collaborative Commissioning Forum in Essex, which was supported and implemented last year.
Kieran, hello.
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 Hi. So has Paula told you about me? I'm the youth facilitator for Positive Pathways. Nice to meet you. At Thurrock and Brentwood Mind, we've employed a youth facilitator to work within the CAMS team locally. And her role is really to meet with young people, their parents, carers, and the therapists, and to look at what their interests are and what they hope to achieve. So it's really a social prescribing model.
Hi, my name's Kiran. I'm the youth facilitator for Positive Pathways, and I work for Thurrock Mind to help young people transition back into the community through offering them extra support.
There are 4 stages to the process. The first stage is a CAMS worker and a Mind Youth facilitator have a pre-discharge meeting with the young person and family.
So why don't you tell me about a few things, some interests that you might have that I could maybe, just to get to know you so I can see where I can help you.
The second stage is a personalised care and support plan session with a mind worker takes place with the young person and family.
When we first met Kieran, it was after one of Lily's counselling sessions. She got introduced to us to help Lily do things like on the other side of counselling, and she's given me lots and lots of information for the help that's also out there for me.
What kind of things have helped you so far then? Because we've done quite a few things together, haven't we?
Like counselling, like just talking to all different people, like just...
The music school as well.
Yeah,
Shared a taste.
it's just helped me boost my confidence, like that's the main thing.
Third stage, the Mind You facilitator sees what's available in the community to meet the needs of the care plan and to support the young person.
As part of young people's personalised care plan, I introduced them to other organisations in Thurrock, such as Thurrock Mind, Prince's Trust, Inspire Youth, Open Door, Peer Mentoring, and Temple Springs, the music school. And I walk them down to the organisation to introduce them to the services.
Stage 4 is the personal health budget, where it is used for young person's needs where there isn't an available community service already identified.
And now you've got your own little circle of friends and, like Joe shared his interest in music and how he wasn't able to access that in college. So I applied for a personal health budget, and so he managed to get 12 paid sessions for one-to-one tutoring for keyboard lessons.
Oh, it's boosted my confidence immensely. I can now actually be confident in going up the stages.
Joe's never, ever picked a career. He didn't know what he wanted to do. But music, I know that he really enjoys and he loves to do it. And hopefully by this, he can do that.
Ellie, when I first met with her, she shared about the lack of the social groups that she struggled with. So part of my work was making groups, and it really helped her meet new friends.
She put me places like Temple Springs, where I got offered a job, and it's given me the opportunity to grow more in myself that I wouldn't have had otherwise.
We are really proud of the work that's being carried out here from our CAMS services and Mind, working in partnership with wider stakeholders across Thurrock. It's been really exciting to see their relationship grow and flourish, with new ideas coming out every time we meet.
The best thing about the whole project is just opening up. It's almost like we've had French windows put into the clinic, and suddenly we can see the outside community and we can see all the resources that are available there.
40 young people have been through the system so far, only 6 of which have actually required a personal health budget to support their personalised plan. This really reflects the amount of resource and opportunities there are out there in the community for young people in Thurrock.
I know now that I'm very confident when I discharge somebody, there's something else out there for them. There's another kind of plan of care.
I really enjoy my work, supporting young people, seeing them flourish. It's almost as if I'm walking alongside them on their journey.
Like she's an angel in disguise for us.
Luckily I had Kieran and the Positive Pathways worker there to give me more guidance and support that I needed.
So thank you. I'd just like to thank Ellie, Joe and Lily for sharing their stories with us, and there are some more detailed videos on each one of their stories available as well in a bit more detail. So I'm going to just stop sharing now, I think, if I can. Okay. So I suppose that's if anyone's got any questions. I haven't been able to sort of manage any of the chat, but I'm really happy to take any questions at this point and answer anything. I think Stevie, my colleague from Thurrock, is also on the line, so she can chip in and help answer some of the practical questions as well.
Someone's asked in the chat, Helen, whether that video is available publicly.
Yes, it is. Yes, it's on. So what I'll do, Dan, I've got the shared link for that one, and I'll send it to you, and maybe that can go out with the notes. But if you just YouTube Thurrock Personalised Care, I think they all come up, and they come up as Ellie's story and Dan's story and Lily's story. So yeah, and that main one's on there. So they're all yeah, fully consent's been given to share widely. They're going out on the national NHSE platform as well.
Perfect, thank you. Alex, do you have a question? Oh, you're on mute, sorry. Can't hear you. Let me just see here.
Natasha.
I was just wondering how you arranged your funding for personal health budgets and how you managed to disaggregate the money from contracts.
Yeah, common question. So, so we actually, I think, identifying the budget to enable any sort of PHB work to happen needs to be done up front. So that's if I've got a bit of advice for you, is find a budget, have a budget put aside for personal health budgets, rather than having to go through a system where you have to apply and find funding each time. Just because one of the feedbacks we've had through the learning is the speed of response is really important for young people. It's for all people really, but the fact that we could turn around decisions within a week and they could go off and do it and we could enable it to happen very quickly was really powerful message of support. So our funding is actually for this programme as a whole, and also for the personal health budget, has come from the local transformation money for children's mental health. So we've set aside a pot of money for personal health budgets from the mental health investment standard. So I don't know if that helps, Natasha. But so we didn't have to disaggregate it from a core contract. I think I don't know if Stevie can add to it, but I think going forwards, I think in terms of our thoughts going forwards is that as we go forwards with the sort of mental health contract, then we will look to actually ensuring that a proportion of that funding is available for personal health budgets. I think that's the way in which we need to take it to go forward, to embed it in wider contracts. But I think to start small and then let it grow is probably a bit easier than trying to disaggregate it at first. Kim? Kim?
Hi, sorry,
Hi.
I was.
That's okay, talking, you know, the famous mute, yeah. Oh, we can't hear you again. I think you've gone back on mute, Kim.
Can you hear me now?
Yes, got you now.
Yeah. How do you work alongside social care? Because some of the provision that was being arranged or activities would be perhaps something that perhaps early help or other social care involvement might arrange as well. So do you work closely with them?
Yeah, we do work closely, and we've kind of pondered on this question a lot actually, because it comes up a lot in lots of forums. Is how does this work as an integrated offer across the piece? And I suppose with this particular programme, we're looking at children who have been within the mental health service and enabling that service to sort of have a more robust offer, if you like, especially on discharge and supporting discharge. So we recognise that some of the things that we're funding definitely, if they had come through a different route, could be funded through social care or early offer of support, etc. But I suppose that when we questioned with the national team, they had quite a good answer, which was around this is the health equivalent of that offer, and it's wrapped around the health offer rather than it's what we're funding itself. It's actually to support that service. And one of the things that we were very mindful of, what I was very keen to avoid, is that we didn't want a long handoff, another handoff for the young person. We wanted it to be integral with that service itself. So we do keep in close dialogue with each other and share each other what we're doing. And a lot of these children are not necessarily known to social care. Some of them go on to be known or referred to, but they're not all known, so they wouldn't have met their criteria for a personal budget under that remit. But I think it's really, really important as a system, when you're developing, that you have those open dialogues and sharing. And in the future, and certainly when we're exploring the sort of personal health budget through EHC planning programme, then we're doing much more joined up personal budgets with where it's coming through the EHC process. But this is a process where it's coming through a different model, if you like. Does that make sense?
Yeah. So is there much crossover with children with SEN and EHCPs? Not so much EHC plans. So a lot of the children, we didn't go out with that intention. It was really sort of based on the mental health service itself. Yeah. But a lot of the children, we've got about 60 children that have gone through the service now, and it's for 16 and up. So it was the older age range that we wanted to look at first. And what we found is that nearly all of the personal health budget requirements were for children with sort of high functioning autism. So they might have been on SEN support rather than EHC plans. Some of them might have had EHC plans, but very few did. They were on the cusp of mainstream school and SEN support, which has been an interesting learning. And there's been lots of, as you kind of would probably imagine, sort of identification of gaps in service locally for that cohort of young people. Is that particularly around those with the ASC?
Yeah, definitely. And maybe that's the cohort of children that need that additional support. It's not necessarily a mental health service once they've come through that, but they need that additional support that they haven't got. And most of them, nearly all of them, are in mainstream school as well.
Yeah.
A lot of them, some are not attending school, so a lot out of school, still on roll but not attending, or very poor attendance. So a number have come through with support going back to school. Now we could, that is a difficult argument. You could say, well, where does that sit? Is it mental health? But I think I've just taken a very pragmatic view, supported by the sort of CCG and partners, that we're happy to support that because it's part of the prevention role. They'll either, stop them come back into the service to keep that wellness, but we link in then very much the youth facilitator will work alongside the education provision to get them back into school and support that journey. But it's almost like a little bit of a health element of it, to just get that dialogue going, which is often unfortunately broken down in many cases.
And are schools fairly supportive of that?
They are, they are very supportive, actually, very flexible. I think, they are. Yeah, they have been very supportive. We haven't had they've welcomed any support that we can get. And in fact, I suppose the message is that they wish they had more of it, or it could have been done earlier. They've had to sort of reach that point before accessing it. And I think that's one of our learning as a system, is actually we need to be more proactive at the front end. We might not even had to go through the CAM services to actually get to that point. But we know that being in school, being in education, being in employment is an absolute key protective factor for emotional well-being and mental health. So even more so now, you know, through in the pandemic, we've really seen that highlighted.
And referral is into CAMS.
Yes, so this particular model is through, it's for those being discharged from CAMS services. Yeah. But we need to think wider how we can share this learning to wider networks. So we just secured some additional funding, and a neighbouring CCG at Basildon and Brentwood have just done the pilot again with Mind, but they've used some of their funding to actually provide a service specifically for those that are out of school, but also known to the mental health services, and they've identified and working in this way in a much more person-centred approach with that cohort, and they've had some great results with that pilot as well. So we're going to hopefully launch that in Thurrock as well.
Okay, thank you.
Pleasure. Julie?
Hi, yes, thanks for that, Helen. I have posted in the chat as well, but I think what really strikes me is, you know, your acknowledgement that person-centered approaches work, and that we need to, you know, it's something that we use a lot through the preparing for adulthood work that we do. And I've just popped a link in because we've created some new tools that are going down really well too. But I think what struck me, we're currently working on a lottery funded programme, doing some planning with young people, and you know, we've got funding for 50 and we were inundated. So all of those places used up within about 3 days, I would say. But not surprisingly, I think mental health and wellbeing comes up for all of them, although it's a SEND specific programme. So, I mean, it's not even a question, really, it's just that observation that we have to get so much better at looking at those kind of multi-labels. I don't like labels personally, but do you know what I mean? Where young people sit across a number of different supports and services and often fall through the gaps because of that.
Yeah, I'm a great advocate of, I completely agree, Julie. And I suppose, you know, I've worked in the field for a long time before coming into commissioning, so I was sort of practitioner before then, and you know, what I could see as a practitioner is the frustration of the fragmentation, and I could, you know, you feel it as a practitioner in the ground working, that you know, and if you can get that dialogue and working together effectively, and that's a lot of that softer stuff through relationships, knowing each other, understanding each other's roles, being able to pick up the phone, but also then being able to challenge effectively as well, you know, when decisions are made. So it's not just, you know, I think our skills in MDT working need enhancing as well, and having, you know, structures in which we can, you know, we've had cases locally where they had really good relationships, but they weren't challenging each other in terms of what was going on, and they were still sort of sharing each other's roles individually, but not actually sharing responsibility for the child as a whole and how they were working together and having the flexibility. And I think that's where I think having the third sector dialogue and voice in the room in those conversations has been very powerful, because they're much more flexible, much more I'd say creative and free flowing in terms of, okay, let's do this, how can we do this? They have much more than the agencies do. They can be.
I agree. It's having a common sense practical approach, isn't it? So this is what we're looking to achieve. Let's strip through whose responsibility belongs to who and actually work out how we're going to get there. Completely agree.
Yeah, and this has only worked because I had managed, you saw Michael on the film there, but he had a very open view as the manager of the service of welcome. He welcomed in Mind practitioners. Now a lot will have, you know, we had to work through the IG issues, we had to work through the governance, we had to work through, but he had a view that, no, this makes sense, this would be great for me to have as a service, to be able to offer this to my young people. And starting from that premise is really important. But we did start without, I think one of the learning, we start with an open dialogue. And I let them lead the dialogue, because it's a no-brainer. Once you allow that conversation to happen, and you say, well, we can do that, I can give you some money for that, I've got the, you know, do a personal health budget. Then their creative juices start to flow, and then they, oh, well, we've got this and this and this, and then that real energy from professionals that's so often probably frustrated within the systems that we have sometimes is allowed to flow. So I think as a commissioner, it's about us putting in processes and commissioning services that allow that creativity and allow that flow and freedoms, I think is really...
You're describing great leadership as well, aren't you, from your manager's point of view, and
Yeah.
it gives you then really rich information around what to commission next too.
Yeah, absolutely. I couldn't do it without them, definitely. And the young people, having them involved in the co-production of the model. So I did have to put, first, the excitement was, as professionals do, and I've done it myself, is, oh, we could do this, we could do that, and I said, actually, no, I'm not going to do. I'm not pre-planning anything, because that needs to come from the young people themselves and their families, and so they'll tell us what we need to do, not we're going to offer them a suite of.
Yeah,
So
and we have a habit of fixing things, don't we?
Yeah, let's have a nice list, and I said, no, they're going to make the list, and we're going to learn from them about what's in there, what's out there, and what Mind did. So what Mind do, and any third sector sort of in a local community does, is they know their community so well. They absolutely know their community so well. They know about the one early example was, there's one of the young people with autism was a very keen chess player, but both his family, his carers had mild learning difficulties, so couldn't play chess in an equal way, and he didn't have anywhere to go. So she said, oh, there's a great chess club in the library on a Saturday morning, I'll take you down there. And then obviously like-minded
community connecting.
Yeah, it's a connecting, networking type of networking approach. We wouldn't have known that. CAM services wouldn't have known that, about the Saturday club. Someone rooted in the community, and having good networks in the community is vital for kind of a community assets approach. I think it's really important.
Yeah, we're looking now to kind of peer-to-peer network, because we're finding young people from different parts of the country have very similar interests and shared talents, and we want to try and make a connection up virtually through those groups as well. But yeah, there's a real gap out there. So yeah, I really appreciate your sharing. Thank you.
Yeah, pleasure. And most of the tools that we use, we're sharing through the NHS platform, NHS Futures platform, so nearly all of those resources are available on there, like our referral forms, our PHB application forms, processes, policies, etc. So I'm more than happy to share that kind of resource if anyone's interested or doing some work. Okay. So,
any more questions from anybody? No. Thanks, Helen. That was really, really interesting and helpful. There's still lots of bits and pieces in the chat, but we'll do our best to capture everything with the recording and get everything together.
Is there anything particularly in the chat that I need to, because I haven't been looking at it?
I think we've addressed most of it. I'm just going to post the link to the evaluation survey. I can see Marie's already put that in there. So if people can take a couple of minutes and just fill that in, it really helps us kind of feedback on how these events have gone, and kind of helps us get funding to keep on doing them, really. So if you can just take a couple of minutes to do that, that'd be great. But unless anybody has got anything else to say, I'd just like to say thanks to Helen, and thanks to you all for spending the afternoon with us.
Well, thank you for a great event, Dan and the team. It's been really informative.
Great, thank you. Well, hopefully we've got 2 more of these events to come, as Christine mentioned at the start. The next one is on the 11th of December, so hopefully see some of you there.
Brilliant. Thank you very much. Keep safe, everyone, and don't have to say have a good journey home now, do you? You just have to say safe.
Thanks guys.
Bye.
Bye.
Thank you.